Myocarditis can progress to a dilated cardiomyopathy and is a leading cause of heart failure in children. Distinguishing genetic dilated cardiomyopathy from myocarditis alone can be difficult, and sometimes the two are reported together, supporting the concept of a shared genetic background. The goals of this study were to A. determine the frequency of pathogenic variants in a cohort of biopsy-proven pediatric myocarditis, B. assess clinical and genetic differences in pediatric myocarditis, with and without DCM phenotype, and C. explore the possible value of genetic diagnosis for outcome in pediatric myocarditis. To accomplish this, 42 unrelated biopsy-proven myocarditis cases underwent comprehensive clinical evaluation and genetic testing with a targeted panel sequencing of cardiomyopathy genes. The cohort was divided into 20 patients who presented with a morphological phenotype of DCM and 22 who did not. On endomyocardial biopsy, all patients demonstrated lymphocytic myocarditis, with viral genome identified in 29% without DCM and 58% with DCM. Patients presenting with DCM were younger and presented with heart failure syndrome versus non-DCM myocarditis presenting with chest pain. 22% of patients were positive for a pathogenic or likely pathogenic variant in a DCM gene, and 13 VUSs were identified. Of these, 7 out of 20, 35% were in those with myocarditis, cases who presented with DCM, versus 9% without DCM. Genes included BAG3, desmoplakin, lamin A, troponin I3, troponin T2, and titin. The clinical outcomes were the same in both groups, although those with DCM were more frequently likely to undergo resuscitation and were more likely to undergo cardiac transplantation. The authors conclude, pathogenic and likely pathogenic variants in DCM genes are more frequent in pediatric myocarditis cases, particularly presenting with DCM phenotype. These patients are also more likely to develop heart failure, undergo resuscitation, and require transplantation. Findings have implications for genetic screening of probands and screening of family members.